So this is a loading technique to the side part of the torso, roughly where the shoulder moves, right down in through here. I'm going to use this roller, I'm going to place it against the wall. When you apply it against the wall, you want it more at an angle like this and not like this. So there's two techniques you can use. The first one I'm going to use is more of the seek and destroy. So right now I'm trying to seek an area that's sensitive by rolling up and down. I can go into a squat lunge position, or I can actually do a slight twist of my body. Once I find a sensitive area, I'm going to hold it there. And then now to destroy it, what I'm going to do is just breathe into it and apply more pressure. So I'm going to take a breath in, exhale, and when I exhale, I'm going to try to apply a little bit more pressure onto the roller while the arm of the side that I'm working on is totally relaxed. So I'm going to find another area, take a breath in, inhale, exhale, and then just try to melt my body into the roller. As soon as it starts to desensitize and it becomes a little bit more tolerable, then you can find another spot to work on. The second technique you can use is more of the pin and stretch. So you're going to do the exact same thing. You're going to find an area that's sensitive. I can do more of a squat lunge type of thing, or I can do a little bit of a twist. Once I feel a position that's sensitive, I'm going to hold it there. And then to stretch it out, what I'm going to do is I'm going to keep that arm of the side that I'm working on out just like that. With the opposite arm, I'm going to open a book, so I'm just going to twist my body towards this direction. So I'm turning my body and opening up. And then go back, I'm going to do that exact same thing, and then slowly use my opposite arm and open up my torso towards the opposite direction, and I'm going to hold that position until it melts. The other method that you can do, the same side arm, you can actually keep it against the wall and slowly slide it up. It's kind of like a snow angel up the wall until you feel more tension. Once it desensitizes, then you can kind of slowly lower it back down. So again, what I'm going to do is I'm going to use the same side arm. I'm going to place it against the wall and drag it up against the wall, kind of like a snow angel, until I feel an additional load in the tissue that I'm working on. Once it starts to melt and desensitize, then I can lower it back down.